An ancient practice of healthcare in Africa, now modernized in a bid to enforce fair and quality traditional training for initiates. There is also a push to clean up the traditional healing sector. Traditional healers say the practice is controlled by ancestors, and the limiting requirements like the age restriction of initiates and their education levels are suppressing the calling.
Yokuba bhuti wam urhulumente makasibekele umthetho wokuba abantwana funeke besetyenzwe xa befike kwi-18 iyenza loo nto kumakhaya amaninzi mawabe nabantwana abanga.
Government's restrictions of having to wait for a certain age in order to work with young initiates is going to lead to many children suffering from mental illnesses. Children will struggle to even continue with school. They will be going in and out of hospitals.
It's a sacred practice. It's not something that needs to be out there for public. That's the first thing. And within the regulations, they demand that we need to disclose certain things. They demand we need to let them know how our daily schedule with Amatwasana, which are the initiates. What did you teach you today? There's a logbook, The secrecy of the art disappears immediately. We have to do that, right? Because these things are obviously going to be audited. By whom?
There is also a claim that the Minister of Health and the Traditional Health Practitioners Council failed to engage traditional healers on these proposed regulations.
The refusal of the interim Traditional Health Practitioners Council and the Department of Health to engage with traditional health practitioners indeed raises a lot of red flags about the potential for exploitation and suppression of indigenous knowledge and practice. What the department wants is to regulate traditional medicine, but they are not able to do so without capturing the knowledge holders, which are traditional healers. The process on its own is very evil, hence there is no room for engagement. It is important to have a balanced discussion about the need for regulations to ensure safety and efficiency while also respecting the cultural practices.
The National Department of Health says thorough consultation was done with all stakeholders.
The Council has embarked on a country-wide roadshow to all provinces to engage with the stakeholders. The consultation meeting in the Eastern Cape took place in East London on the 14th of August 2024, and participants were drawn from all the districts of the province. Apart from this process, there was also a meeting of associations of traditional health practitioners from across the country who convened in Gauteng on the 19th of August 2024. The Department of Health is aware of some individuals who raised concerns with the department, and we say the door remains open and will give anyone with concerns our audience in order to better understand their concerns and see how we can intervene.
The department says the process of implementing the regulations is in its final stages, and traditional healers say they will continue to mobilize and challenge these regulations. Sidima Mvegu, SABC News, East London.